Hey, you guys. Welcome to day 2 of our March Madness practice questions. Let's get into our things for today. But first, I like to always start with my disclaimer. For those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. And I do these videos and provide resources and tools to assist nurses and nurse practitioners with boards as well as in practice. Now, I always like to give this disclaimer um, just simply because we treat on a patient by patient basis. There's no absolutes in medicine. And I want you to treat all of these questions as such. This is geared and designed to prepare you for boards and various strategies and content level to test your knowledge, strengthen that muscle memory so that you're able to strengthen your knowledge and apply it appropriately for the exam. Okay. So just keep that in mind as we get into the questions. Let's go. All right. Question number 1 states the nurse practitioner student is reviewing the patient's labs and is explaining to the preceptor that she notes microcytic hypochromic values with normal ferritin and iron levels. She is trying to determine what type of anemia the patient has. What would be the best response by the nurse practitioner? Is it A, B12 deficiency anemia, B, thalassemia, C, iron deficiency anemia, or D, folate deficiency anemia? Take a moment and tell me what you think in the comments. All right, you guys, I always stress to read the stem of the question first, just so it slows you down enough to make sure that you are answering even what the question is asking, correct? Not that we're getting stuck on the scenario and creating our own storylines, but answering what is truly being asked of us and slowing us down so that we're not missing those key terms that, like accept, not, etc. Okay. So in this question, the stem of the question states, what would be the best response by the nurse practitioner? So the nurse practitioner student is, chatting with the nurse practitioner preceptor, letting them know that they see on the labs that the patient has microcytic hypochromic values, the ferritin level, iron levels are normal. She's trying to determine what type of anemia this would be. And so just slow down and think about it. And we can look at it in various levels. One, you need to be able to identify what lab values make this microcytic hypochromic, okay? Right. So check out my anemia video with my 2-1-2 rule that can help you with that. But to narrow it down, we know that it's microcytic hypochromic. I always say there are two of the lower scale anemias that fall into that lower category out of the 5 main ones that we usually talk about, right? So we usually see the iron deficiency anemia, the thalassemia, the anemia of chronic disease, the B12 deficiency anemia, and the folate deficiency anemia when we're talking like true lab values, right? So the hemoglobin, hematocrit are low, but then we have to look a little bit deeper. We're looking at that MCV, that MCHC to kind of delve a little bit deeper into what type of anemia it is. And when I talk about my 2-1-2 rule, if you are not familiar with it, I say there's 2 out of that 5 that falls into that microcytic hypochromic range, right? And so we can narrow that down to B and C of this. Iron deficiency anemia and thalassemia are the 2 that fall into that category, and they present with microcytic hypochromic values. Now you have to be able to determine one versus the other. So I always say when things present similarly, you have to have a way to differentiate, right? So how do you know iron deficiency anemia versus thalassemia? One, this says that the ferritin level and the iron levels are normal. Well, we can quickly eliminate iron deficiency anemia at this point because the iron levels are not normal, right? Because we are deficient in iron. So the iron level will be low, as well as the ferritin levels. Ferritin levels are your iron stores. We don't have iron stores. We're deficient in iron. So the best answer here is thalassemia. With thalassemia, we have that microcytic hypochromic, but the ferritin and iron will be normal, okay? And again, if you want to get a little bit deeper into all of the anemias, go check out my anemia video. If you go to playlist, you'll see where it has a category called anemia, and you'll see my 2-1-2 rule that people have found helpful, and I hope you can find it helpful as well. All right, let's hit question number 2 for today. A patient presents to the office today with complaints of right lower quadrant pain, Upon examination, there is noted rebound tenderness at McBurney's point. Based on these findings, what is the nurse practitioner's best action? Is it A, have the patient to follow up in 1 week, B, refer for surgery, C, prescribe prednisone, or D, order a lower extremity Doppler? Take a moment and tell me what you think in the comments. All right, stem of the question first states, based on these findings, what is the nurse practitioner's best action? So the patient comes in, they're complaining of right lower quadrant pain. You need to think of what falls into the right lower quadrant. I have a video too that shows where you can see everything in all those quadrants that are the common diagnoses, just because sometimes you just need to view it so that you can remember in case you get stuck on any of your exams. But right lower quadrant pain, you need to start thinking of that anatomy, right? And then they're having rebound tenderness at McBurney's point. I stress those key identifiers. If we say rebound tenderness at McBurney's point, instantly you need to think appendicitis, right? And so, we're not going to have them come back in 1 week. That's not solving anything. You need to refer them for surgery, okay? And yes, again, stuff like this I know are very simple questions, but I do this for a reason. Because when you think of how the test is broken down, assessment, diagnosis, evaluation, treatment, as I always stress, these are certain things that they're going to do to test you, because they want to make sure that you're able. This is an assessment style question. It's letting me know that, hey, that when someone presents with right lower quadrant pain, rebound tenderness at McBurney's point, you're able to assess them and identify, that this is appendicitis, right? So that's telling me that from an assessment standpoint. But it also lets me know that you know how to treat them as well, by referring for surgery. So that will answer a couple of those categories, okay? So I do it for a purpose. Trust me. All right. And the last question for today. A patient presents to the office today with complaints of otalgia. On exam, tympanic membrane is red and inflamed. What is the best diagnosis based on the patient's presentation? Is it A, otitis externa, B, acute otitis media, C, tinnitus, or D, tympanic membrane perforation? Take a moment and tell me what you think in the comments. All right, you guys. Stem of the question states, what is the best diagnosis based on this patient's presentation? So the patient came in, they're having ear pain. They had that otalgia. And then on exam, the nurse practitioner notes that the tympanic membrane is red and inflamed, right? So what do you think about when you hear that? These are classic descriptions. Also, make sure you know those classic descriptions of certain diagnoses. But this is classic for acute otitis media, right? So B will be your best answer choice. Remembering, think about it. We're talking about that tympanic membrane. We're talking about the media, the middle of the ear. Let that med terminology kick in for you, okay? Because with otitis externa, the external portion, they complain more of tragal pain, right? So don't let that trip you up. All right, you guys, as always, don't forget to subscribe, but make sure you like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But sure that you meet me back here for more practice questions. And if you need assistance, if you would like to do any one-on-one sessions, if you need any review resources, any questions or things that you may need assistance with, or some consultations to get you on the right path, retesting or testing for the first time, be sure to reach out to us at the Nursing Studio. I am happy to work with you. Just give us a call at 803-400-6864. I have some more openings for the month of March for our one-on-one sessions. But even if you're looking at this at a different time, just give us a call or shoot us an email at the nursingstudio1@gmail.com. And I look forward to working with you. But as you're on your studying journey, meet me back here. We're hitting practice questions all month long. Happy studying. Bye, y'all.